Men should know many things before being diagnosed with prostate cancer. Number one, when should they begin testing? What kind of test they should have? And what we recommend now is a PSA test. That's a blood test. PSA stands for prostate-specific antigen, and also a digital rectal examination. We know that the PSA is a good test, and some people are suggesting that that's the only test you should have. You don't need the rectal exam. But we who've been in prostate cancer research and have experience know that the digital rectal exam should be done, because 15 to 20% of men who have prostate cancer may have a normal PSA. Also, an abnormal PSA can be from an enlarged prostate or from an inflammation of the prostate. It's not 100% accurate. So a digital rectal exam adds to the accuracy of being diagnosed with prostate cancer. So what age should you be tested? For intermediate risk population, that's for Caucasians. But for high risk, African Americans or men with family history, we recommend age 40. The American Cancer Society says age 45 for Africans, and for men with a family history, age 40. But we say age 40 for both, based on my experience as a researcher in this field. Also, men should know their family history. That's extremely important. We know that prostate cancer can be inherited from generation to generation within a family, but we also know that if you have multiple members with different kinds of cancer, such as breast cancer, ovarian cancer, colon or lung cancer, that puts them at even greater risk of having prostate cancer. And prostate cancer can be inherited from the father's side or from the mother's side. The mother's father or the mother's brother may have had prostate cancer, and that may be inherited to the particular member of that family who is being tested for prostate cancer. Lifestyle is also important, that you do these things well before you even test it. Early, like in age 20 and 30, you should start thinking about weight control, because we know that obesity is a factor for aggressive cancers, not just prostate cancer, but other cancers, as well as heart disease and diabetes and all the other factors. So obesity is just bad for good health. Also, exercise. Exercise is key, extremely important. We know that cancer is a genetic disease, and exercise can decrease the expression of the genes that are responsible for aggressive prostate cancer. Also, decrease smoking. Smoking can be a risk factor. And alcohol, excessive alcohol. Alcohol diminishes the immune system to help fight the cancer, so you want to do that. There is one other factor, and that is diet. We know that high-fat diet is not good, and it's not good for cancer. It can drive the cancer. It increases the genes that are responsible for aggressiveness of the cancer. So we recommend a low-fat diet and a high-fiber diet. Now, are there some things that may prevent cancer in a diet? Tomatoes have been suggested. Pomegranate has been suggested. Also broccoli and other things that are in a high-fiber diet may be preventive of prostate cancer. Doesn't mean it's foolproof, but it may prevent prostate cancer.